Mild back pain, fatigue that lasts all day, trouble sleeping, irritability. You think it's just a result of aging work stress or the weather. But sometimes heart attack in men starts just like that, no chest pain. There is no dramatic warning, just a few unusual signals and then the heart quietly stops. Most men ignore the small changes in their bodies. Persistent tiredness, a little insomnia, some strange back pain all. It gets dismissed with the exact familiar phrase, "It's nothing." But the truth is, heart attack symptoms in men are often not loud. It is not the dramatic chest-clutching scene from a movie. It is not someone screaming before collapsing in the street. Men often experience a silent heart attack. A heart attack that comes quietly and is sometimes only discovered after it is too late. In this video, I will reveal 5 warning signs of a heart attack in men, of which involve chest pain. If you or someone you love has even one of these signs, do not stay silent, because the heart does not wait. Symptom number 1. Persistent fatigue without a clear cause. Fatigue is normal. That is what most men over 60 say when I ask about their health. However, when that fatigue lasts for weeks, does not improve with rest, and is accompanied by a sense of exhaustion, for no apparent reason, it is no longer considered normal. For many male patients, the early signs of a heart attack begin with days of sluggishness. They do not want to get out of bed. They no longer have the energy to take a few laps around the house like they used to. Every step feels heavy, and even something as simple as getting dressed leaves them short of breath. But since there is no chest pain, they dismiss it. Your heart is a muscle. When it is not working correctly, it cannot pump enough blood to your organs. That kind of fatigue is often the very first warning bell. Especially in men, heart attack symptoms, male tend to show up as physical decline rather than pain. Unlike women who often recognize fatigue when it is paired with emotional symptoms like sadness, anxiety, or digestive issues, men usually ignore it. They assume they are just getting older rather than facing an apparent heart attack warning sign. One of my patients, Mr. Thomas, a 67-year-old, once told me that he had to sleep 10 hours a day but still woke up feeling drained and heavy. It was only during a routine checkup that his EKG revealed silent myocardial ischemia. That was when he realized his heart had been sending out distress signals for the past 2 months. Symptom number 2. Silent shortness of breath. When the heart can no longer keep up with you. That's strange. I just climbed 1 flight of stairs and am already out of breath. If you have ever thought something like this, stop and take a moment. Shortness of breath is one of the most common signs of a heart attack, yet it is often overlooked, especially in men. For many people, shortness of breath comes on gradually. No pain, no cough, no fever. But every time they exert themselves, just a little. Lifting groceries, cleaning the house, standing for too long. The feeling of gasping for air, rapid breathing, or needing to pause to catch their breath shows up. That is not just fatigue. That could be heart attack symptoms in men, quietly warning that your heart is not getting enough blood and your lungs are not getting enough oxygen. Shortness of breath in men is often dismissed. They believe they are just out of shape. In women, the same symptom often comes with anxiety and chest discomfort, prompting them to seek medical help sooner. This may explain why many men arrive at the hospital later and have a higher fatality rate after a heart attack. One of my 64-year-old patients once told me, "I just thought it was age. That's why I was out of breath climbing stairs. I had no idea my coronary artery was over 80% blocked." Here is how it works. When the coronary artery's narrow blood flow to the heart is reduced, the heart weakens and cannot push enough blood to the lungs and the rest of the body. The lungs get slightly deprived of oxygen, and shortness of breath becomes the first consequence. If you find yourself unusually winded, even without intense activity, or if it feels like you have to work harder just to breathe, do not ignore it. That is not just aging. That may be one of the early warning signs of a heart attack your body is trying to send you. Symptom number 3. Pain in unexpected places, back, neck, jaw. Shoulder or teeth. When people think of a heart attack, most especially men, immediately picture sharp pain in the left side of the chest. But in reality, many heart attack symptoms, male, do not appear in the chest at all. Instead, the pain radiates to unexpected areas such as the back, shoulder, neck, jaw, or even the teeth. Why does this happen? The heart and these areas, like the neck, shoulders, and jaw area, connected by the same group of nerves. When the heart lacks blood flow, the brain can misinterpret the signal, and you may feel pain that seems to come from your mouth, a stiff neck, or an awkward sleeping position. One of my patients, a 61-year-old man, had a dull ache in the left side of his jaw for several days. He visited the dentist, but there was no cavity or gum disease. Only after a general checkup and EKG did we find ischemia in the lower part of the heart, a region known for causing pain that radiates upward toward the jaw. This is where men are often misled. Women tend to feel pain along with fatigue, shortness of breath, or nausea, which makes them suspect a heart issue sooner. Men, on the other hand, often tolerate random pains, like a sore shoulder, sensitive tooth, or a stiff neck, and rarely suspect these could be early signs of a heart attack. Here are some pain locations that are dangerous but commonly overlooked. Middle of the back, it feels like a heavy weight pressing down. Left neck and shoulder, persistent soreness for no apparent reason, unrelated to movement. Jaw and teeth, vague, dull pain or sensitivity with no apparent dental cause. If you experience pain in any of these areas, especially if it comes with fatigue, shortness of breath, or cold sweats, do not assume it is just a muscle or joint issue. Think about your heart. Because heart attack warning signs sometimes appear in unexpected places. Symptom number 4. Cold sweats and unexplained anxiety. Some heart attacks do not begin with pain. They start with a strange feeling. A vague sense of unease, a cold sweat soaking the back of your shirt, or a sudden moment when your heart races for no reason. For men, this is one of the most overlooked and most dangerous heart attack symptoms, male. Remember, not every heart attack feels like dramatic chest pressure as seen in movies. Many people experience a silent heart attack where the symptoms are subtle and quiet. In men, anxiety is often blamed on work stress, financial worries, or age-related insomnia. However, when a sense of unexplained nervousness is accompanied by cold sweat, a rapid heartbeat, or shakiness, it is no longer just psychological. It is a sign that the sympathetic nervous system is reacting to acute ischemia, or a sudden lack of blood flow to the heart. In women, this sensation often accompanies nausea, shortness of breath, or abdominal pain, which helps them recognize that something is wrong. Men, on the other hand, tend to suffer in silence, thinking, it must be the food, poor sleep, or everyday stress. I once treated a 58-year-old man who walked into my clinic with his shirt soaked in sweat and a pale face. He said, "I feel nervous, my heart is racing, I can't sit still. It's like I'm worried, but I don't know what I'm worried about." His EKG showed severe myocardial ischemia. Thankfully, we caught it in time. If you have ever felt similar sensations, especially if you break into a cold sweat while at rest or feel anxious for no apparent reason, do not blame it on age or pressure. It may be one of the early signs of a heart attack, the heart's last quiet knock before it shuts down. One more symptom remains. It is often mistaken for a stomach issue. Many people took the wrong medication and never woke up again. Let us now move on to the final sign: unexplained indigestion, nausea, and heartburn. Symptom number 5. indigestion, nausea, and heartburn. When you think it's your stomach, but it's your heart. This is one of the most misleading symptoms for men. Indigestion, mild nausea, or heartburn may sound like a digestive issue, and most men simply take an antacid and lie down. But in reality, heart attack symptoms in men sometimes begin exactly with these sensations. The reason is simple. A part of the heart lies close to the stomach. When the lower part of the heart is deprived of oxygen, for example, due to a blocked coronary artery, nerves in the abdominal region are also affected. As a result, the person may feel bloated, nauseated, or a burning sensation in the lower chest. That is why many heart attacks in men are misdiagnosed as acid reflux or digestive stress. Women can also experience this symptom, but it is often accompanied by fatigue, jaw pain, or dizziness, making it easier for doctors to detect. Men, however, tend to downplay it. They take an ulcer pill, get some rest, or blame it on last night's greasy meal, until it is too late. One of my patients, Mr. Robert, 60 years old, said he just felt a bit of an upset stomach and mild nausea, like food wasn't digesting well. But his wife, a former nurse, noticed he looked pale and was sweating on his back. She immediately called 911. By the time the ambulance arrived, he was having a myocardial infarction, a full-blown heart attack. If you frequently experience unexplained bloating or nighttime heartburn, especially when it comes to fatigue, shortness of breath, or pain in the left shoulder, think beyond your stomach. This could be one of the early warning signs of a heart attack, and responding quickly may be the only way you will have the chance to do anything about it again. Some men have survived the war, endured poverty, and raised entire families. But in the end, they collapsed because of something that seemed so small, ignoring a few vague signs in their bodies. None of us are invincible, but if you take the time to listen, to pay attention to the little things like feeling breathless while tying your shoes, a stiff neck for no reason, or a night of overwhelming fatigue. Even though you did nothing all day, you'll realize your heart has been trying to speak to you all along. Women are usually more cautious when it comes to health. Men, we tend to stay silent, push through, and sometimes pay with our lives. So today, if you've made it this far, I ask just one thing. Do not ignore strange signals from your own body. Early diagnosis is not about being afraid of disease. It is about continuing to live, living stronger, longer, and more fully with the people who love you.